In this video, I explain who a Nurse Assistant Curative is, or who an enrolled nurse is, the work they do, and the places they can work. And if you are interested, please stay tuned. Enrolled nurses wear the green uniform with a green cape and a white band, and that is what differentiates the enrolled nurse from the other nurses. Now, Nurse Assistants Curative or enrolled nurses, and for the rest of this video I'll refer to them as enrolled nurses, are nurse assistants who work in the clinical setting. They are at the front of patient care. In clinical care or in clinical medicine, is the doctor and a whole lot of health professional like the pharmacists, the lab technicians, a whole lot of people coming together to manage one case. But when it comes to patient care, where nurses are more dominant, it's the enrolled nurses that are in the front of that. So they assist patients in getting themselves clean, in feeding patients. So patients who are helpless and cannot feed themselves, the nurse assistants feed these patients, sometimes giving them bed bath, mouth care, and all of that. Sometimes, and also monitoring their vital signs. And they work with the other nurses. They work as a team, so with the general nurses. Their training is like the general nurses, but they have a shorter training. So enrolled nurses are trained for 2 years, whilst a registered general nurse is trained for 4 years. And so the enrolled nurse works under the supervision of the registered general nurse. So they are trained for 2 years, and you don't go for any national service. You are posted as soon as clearance is given. You are posted and you start working. So where can they work? Enrolled nurses can work anywhere sick patients go to. So from the teaching hospitals all the way to the CHIP zone. So at the CHIP zone, you find an enrolled nurse and a community health nurse managing this CHIP zone. So while the enrolled nurse focuses on people who are sick and come to the facility for the management of minor ailments, the community health nurse or nurse assistant preventive also looks at the public health issues and attends to public health issues. And sometimes you find enrolled nurses at the school infirmaries. So enrolled nurses can also be school nurses in school infirmaries. But those who go to the school infirmary are people who receive extra training so that they can prescribe medicine and also take care of the students before referring them to the health center or the hospital for further care. Being an enrolled nurse comes with some benefits, because let's say maybe you are interested in being a nurse in the hospital, but your grades are not up to the requirements for you to do for you to become a registered nurse, and so you might be thinking of choosing the enrolled nursing, which is great. And so when you then decide to upgrade to maybe an RGN status, it's easier. Most times it's a post-basic course, it's a post-basic program. So the hassle of going for interview and all of that is cut short, because you are just it's a top up. Most of the things you go and learn in the school you already know, and so it's kind of a formality to upgrade your certificate and upgrade yourself. So it's easier for you to rank up, or it's easier for you to progress in clinical care and then become whoever you want to become in the field. If you are interested in enrolled nursing, go for it. It's a good way to start your career. Enrolled nursing puts you in the clinical setting, and in the clinical setting there are a lot of opportunities. There are a lot of fields that you can specialize in. Talk about ENT, talk about dental nursing, critical care nursing, emergency nursing, a whole lot. So being in that setting alone gives you the opportunity to expose yourself to some of the specialties and then see if your interest is there, so that whilst you are trying to upgrade to a registered nurse, you also at that point determine which path to choose, so that you are not stranded. Most times you don't know what career to choose, and so you'll be stranded. But enrolled nursing is a great opportunity for you to expose yourself. Sometimes even if in the hospital setting you feel like this work might not be for me, because you are an enrolled nurse, you are able to see that early, and then if you move out of the field, you move and become whoever you want to become. And there are lots of schools here in Ghana, both private and public schools, that offer enrolled nursing. I think it's one of the commonest course that you will find in the country. So if you're interested, hey, go for it. And like this video, share and subscribe if you've not done that yet. And I'll see you in my next one. Bye.